Administration, this is Karina. How can I help you?
Karina, this is Ma'am.
Hi, ma'am. How are you?
Hello? Hold on.
What does it say now?
It's on.
There you go.
Thanks very much.
You're welcome.
Thanks everyone for bearing with us. We had a few technical problems here, and so we have started the media briefing with a little technical help from here on the third floor. So thanks very much for joining us, and sorry for the delay. We're going to go ahead and get started. We're very pleased to have Andrea Zutzma, who's the director of the VNA Community Services, on the briefing today. The VNA has been a real important participant in our vaccination efforts, but right now they want to talk about flu. So Andrea, thanks for joining us, and tell us about what the VNA is doing for flu this year.
Please confirm you can hear me all right first.
I sure can.
Okay, I am out setting up for a flu clinic out in Carmel Valley. This year, we are anticipating every flu season. We say if you've seen one flu season, you've seen one flu season. Everyone is different. And while the flu is very unpredictable, because there were such low levels of flu influenza activity in the United States and actually throughout the world last year, we're anticipating that there could be a rebound season this year because people's immunity was diminished. They didn't have any exposure to flu viruses last year. So we're anticipating that it could be a double whammy this year or a very intensified flu season. So we're out preventing the flu with flu vaccinations now. And October is the best time to get a flu vaccine because here on the Central Coast, the flu peaks in January, February, and your immunity lasts about 6 months after having a flu vaccine. So you want to get your flu vaccine and in October and November so that your immunity is strong when the flu season is peaking in January, February. And as I say, of course, it's unpredictable. We never really know. But on the Central Coast, it's generally January, February. So as a result, we are out in the community providing flu vaccines. Everyone 6 months of age and older should receive a flu vaccine. And there are various different types of flu vaccines this year. We have the flu mist that's an intranasal mist that's approved for healthy people between the ages of 2 and 49. We have the high dose flu vaccine that is approved for people 65 and over. And the high dose vaccine was designed for people 65 and over because it's a natural part of the aging process that your immune system weakens. So the high dose vaccine gives 40% more antigen, which gives your immune system a stronger punch. So we have the high dose flu vaccine. We also have most vaccines, flu vaccines are made in egg embryos. So those who have egg allergies were not in the past able to get a flu vaccine. We now have vaccines that are cellular based and so that they can be administered. That the one that we have is called Flu Block, and it can be administered to people with egg allergies. So as I say, influenza activity during the 2021 season was unusually low. And that's probably because of the mitigation measures like mask wearing, staying at home, hand washing, school closures, reduced travel, and physical distancing. But that low level of activity could return this year, with the upcoming flu season, relaxed COVID-19 mitigation measures will likely result in the resumption of seasonal flu virus circulation. And we certainly don't want co-infection or to further stress our already stressed healthcare systems.
So, Andrea, let me ask you, you mentioned co-infections, and I think a lot of people wonder if they get a cold, they wonder if they have COVID. Can you talk about the differences between flu and COVID in symptoms and when to know, when to get tested and when you might have the flu?
Sure. Unfortunately, it's pretty easy to tell the difference between the cold and a flu. The cold comes in slowly, you get a little scratchy throat. It usually isn't associated with a fever. You maybe have a little bit of a cough or sneeze, a little earache, but generally it's mild and, doesn't, you should stay home, but it doesn't require, people's level of energy is impacted, but not like it is with flu or COVID. Unfortunately, flu and COVID are very similar in their symptoms. Very often there's a fever associated with it. It comes on suddenly. Can be a cough, a sneeze. So it's difficult to know which you have. The incubation period is about the same. So it's really hard to know between flu and COVID, which you have. So I think probably to err on the side of caution and be tested for COVID would be the best thing. Again, it's really important that people stay home when they're sick, regardless, and that they isolate themselves. Did that answer the question?
Oh, yes, it does. Sorry, and
Okay.
I was going to respond and I needed to unmute myself to do that. If
And
anyone has, go ahead.
One of the other questions is when you're talking about co-infection, co-administration of vaccines. We've had a number of questions about if one can have a flu vaccine at the same time as a COVID vaccine. And in the beginning, when the COVID vaccine first came out, it was novel. We didn't know. And so that was one of the screening questions. If you'd had any vaccines within 2 weeks, we did not administer the COVID vaccine. That has now been studied. So we're well aware that there is no contraindication to co-administer the vaccines. So the COVID vaccine can be administered with other vaccines.
And that's really good assurance for the community who would still have a lot of questions about that. I'm also hoping you might talk a little bit about COVID vaccines. The VNA has been giving vaccinations over many months, and many of the seniors who you gave and many people you gave vaccines to had Moderna and Johnson & Johnson. So there's this whole issue of third doses and boosters. Can you talk a little bit about how you're assisting others with vaccines at this point?
Right. So as you know, the Pfizer vaccine is the one that required the deep freeze. So as a result, we had the Moderna vaccine and the Johnson & Johnson vaccine. And we held large mass vaccination clinics for people 75 and over, and then 65 and over. And then as the restrictions loosened, then we had vaccination clinics for all of the above. So what I anticipate, this week is the week that the Advisory Committee on Immunization Practices is going to be meeting to make a recommendation to the FDA. And when the Moderna vaccine is approved for a booster dose, then we will go back to those locations that we had set up mass vaccination clinics for seniors and set up clinics again. That is our intent. Now, at that time when we were offering them the first round for 75 and over, and then 65 and over, there were few providers. So we were one of few providers. Now, the pharmacies are in the game. There's more providers. So it may be easier for people to get vaccinated. On the other hand, people left the county to be able to get vaccines in Santa Cruz, Bakersfield. So those people that received vaccines elsewhere will be looking to stay local to receive their booster dose. So we'll be managing some mass vaccination clinics as a result.
All right, thank you. I don't have any questions for you in chat, and I know you have to step away to do a flu clinic today. Just reminding people, Andrea is going to have to leave the call if you have any questions for her. Andrea, any final recommendations or thoughts for people?
Well, last year, a record number of flu vaccines were distributed during the season because you remember last year at this time, we did not have a COVID vaccine. So all people were concerned about getting vaccinated. So it was a great year last year for flu prevention. And I'm concerned this year that people may have a little bit of vaccine fatigue. Do I get a booster? Have I gotten my second dose? That sort of thing. So I'm hopeful that people will still realize the importance of a seasonal flu vaccine and how many people are impacted, hospitalized, deaths, lost work time associated with the flu. So we really need to continue our efforts to vaccinate people. Now is the best time to get vaccinated so that you're well protected as we enter the holiday seasons.
All right, thank you. And I think looks like we've covered everything because I have no questions in chat. Andrea, thanks very much for taking time out today to talk
Right.
with us about flu and vaccine and the good work of the VNA.
Okay, and I'm always available for questions at our office in Ryan Ranch. We're doing curbside appointments at our office in Ryan Ranch, and we are still doing corporate flu clinics. So if your place of employment has not yet vaccinated your employees, we're happy to come on site and provide an on-site clinic. We're very mobile.
All right, thank you. And I hope everything goes well this afternoon.
Thank you.
All right. So now we're going to move on to our health officer, Dr. Moreno, who's joining us today. Dr. Moreno, do you have a presentation or do you want to go ahead and just take some questions?
Good afternoon, Amanda. I have no update today, but I can take questions.
All right, so I've got plenty of questions for you in chat today, so I'll go ahead and get started. First question, for Halloween, children will be likely flipping on masks as they head out to trick or treat. Is this a good substitute for a regular mask that we've been used to in our day-to-day lives during the pandemic, or should children expect to be double masked?
I would, thank you, May. I would just suggest that parents who are choose to take their kids out trick or treating have their children wear a face covering. I don't think that the children need to be wearing a face covering and a mask at the same time. That might be a little too constricting. So recommendation is that children wear face coverings.
All right, thank you. The next question, is the Delta variant surge over?
Thank you, ma'am. We're still in a pandemic and we still have in this third surge, we're still seeing patients that are suffering from serious illness, and we still have patients that are being hospitalized with COVID-19. So it's really important that we recognize that we're still in a pandemic, people are still getting sick, and so the emphasis really still is for people that haven't been vaccinated to get vaccinated, and anyone who has an immune deficiency and have only received two of the Moderna or two of the Pfizer or two dose series should get a third dose. And then finally, anyone who's eligible to get a booster should consider getting a booster shot.
Next question, if there is a surge this winter, would it involve one of the known variants, or would that only happen if a new variant were to emerge?
Thanks. So there's still a lot that to learn about this this virus that's caused this pandemic. We do know that variants are emerging all the time, but I don't think there's a way to predict what variant of concern may arise next. So again, I think it's very important that we continue to do what we've been doing to try to reduce the spread of COVID-19, which is get vaccinated, wear face coverings, stay home when you're sick, and wash your hands frequently.
Thank you. Next question, will the Board of Supervisors mask mandate go into effect October 29th, or is that moot now?
You know what, we could probably take that question back to the CAO's office or county council and see if they want to give a response to that.
And I can say though that the mask mandate is triggered by CDC case rates, and right now those rates don't seem to be in the danger area. But I will follow up on that for the reporter who asked and let them know, and then I'll also share with everyone.
Okay.
Next question. Are there any preliminary details in place with elementary schools to help get children vaccinated once Pfizer's vaccine gets the okay to give to children, to give kids the COVID-19 vaccine?
Sure. So again, that's probably a question for maybe the Monterey County Office of Ed, and maybe we can pass that over to that office. In terms of, I can only speak for public health, and for our public health bureau, we are currently providing COVID vaccinations for children, specifically the teenagers 12 and up. We do require parental consent, and that an adult be present for the child to be vaccinated. And we anticipate that as we continue to provide vaccines to the general public, when the vaccine is authorized to be used for children, we expect most likely 5 to 11. We will continue to provide vaccinations through our community clinics that we continue to hold, and allow those children to be vaccinated as well.
All right. Thank you, Dr. Moreno. That appears to be all the questions that I have for you right now. Are there any additional questions that anyone has for Dr. Moreno before he leaves the briefing? Giving it a couple of seconds here. And then that is all the questions I have for you, Dr. Moreno. If any additional questions come in, I will certainly forward them to him. Thanks, Dr. Moreno, for joining us today.
All right, you're welcome. Thank you.
All right, so our next participant is Joanne Iwamoto. She's the Cannabis Program Manager for Monterey County. Yesterday, the Board of Supervisors discussed a cannabis equity program and how that would look. And Joanne is joining us today to talk about what is an equity program and who it would help. Hi, Joanne.
Hi, Maya. I'm happy to be here. So yes, so the cannabis program did present to the board yesterday a equity program framework, and that was approved. The purpose of an equity program is really to focus on those that were impacted by the war on drugs, specifically those of color and other minorities. And the goal of the program will be to ensure equity, diversity, and inclusion in the commercial cannabis industry to our best ability. Yesterday, what we presented is we identified a criteria for the applicants and then also the framework. The framework is yet to still be further developed, but it will include a revolving loan fund, technical assistance that will include skill-based training, legal assistance as it relates to expungement of records. There will be a component that we're titling shared use facilities, which often is referred to as incubators. There will be a consideration for some permit fee waivers, and then there is a program, or it's a concept called retirement, remediation, and relocation. And that really is the land use component. So with that, Maya, if you have any other questions or comments.
Thank you very much, Joanne. If anyone has any questions for Joanne, now is the time to put them in chat. Joanne, if people are interested in an equity program, I know there's still time yet because there are grants to be applied for, but if people are interested, what should they do at this point?
They should definitely reach out to the cannabis program. We have a web page and we have a link there that they can send an email directly to me or to the program itself, and we'd be happy to answer any questions.
All right. It doesn't appear we have any questions for you. Thanks very much for giving us an update on the equity program, because I know we'll be hearing about it in the months to come.
Okay, you're welcome.
Thanks, Joanne. And then last but not least, we are very pleased to have Jana Falk from the Salinas Valley Recycles program this afternoon. She's going to be talking a little bit about food scrap recycling and compost. And really, thank you for joining us, Jana. And I understand you also have a survey going on that people can participate in to find out what's ahead with food scrap recycling.
Yes, can you see my screen here?
Sure can.
Okay, so I'm here today to talk about the food scrap program that is going to be coming to all residents in Monterey County starting January 1st. Right now, businesses can sign up for food scrap recycling, but we are going to roll it all out to all residential, and that'll be both on the Salinas Valley Recycle side and the Monterey Regional Waste Management District Peninsula side. So we right now are trying to determine if our images that we're planning to put on kitchen pails, little caddies that people could utilize in their homes to collect the food scraps and then bring it out to their green bin, if they resonate with people, and kind of figuring out what is the best image. And so we're going out to the community to do this little survey. There's a few questions. Monterey County Environmental Health Bureau has shared it. And I believe the Monterey County General page will be sharing it soon as well. So as you see these, if you don't mind sharing with your social media as well, that would be great. Additionally, on the composting side, we are also going to be having our first back in person composting workshop at our garden at Hardin El Sol at the Sun Street facility on Saturday. And so every person that comes can get a free compost bin for their household, or every household that comes. And it's an hour-long workshop. You get to ask questions of our expert composter. And so if you are interested, you can sign up on our website, but you can also just show up and we can help everyone. I'll put the link here. And I think that's it for me right now, unless there's any questions.
I'll let people go ahead and put questions if they have any, but tell me a little bit more about the survey. What are you hoping to gain from the survey? So how can people help with this process?
So really, we're trying to figure out if the images resonate with people, and if we show a picture of an apple core, if they also understand that other bits and bobs of vegetables and fruit also are included. Let's see, I don't think it'll let me go the next one. One of the questions, we have an image that we all know what it is because we added it to the picture, but we're not sure if the residents would understand what that is. So we're just trying to really hone in on what resonates with people, because we want to we're going to be purchasing 10,000 kitchen pails to go out to the communities. It'll be on basically a pickup service. They can come to city halls or our facility and get a bucket if it's something that they would like to utilize as their home kitchen compost collection. And so we want to make sure, as we're doing this work and as we're branding these materials, we really are meeting the needs of our residents, and we want to make sure that everybody has understanding of what it is. Additionally, this is part of our community-based social marketing program, where we're funding a study on what the best delivery method of these materials are, making sure our taglines and information that we're sharing with the public makes sense, because this material that's going to go into the green cart is going to come back to our facility and be composted and then go hopefully back out to farms. And we need to make sure that that's clean, because nobody wants plastic in their salads. So we really just need to close that loop and do it properly, since this is going to be the first time in Monterey County that compost is collected. We want to make sure that it's very clear, everybody really understands what they're being asked to do, because contamination just means it's going to be more expensive for everyone in the long run and less quality product. So we just want to make sure that that's a good marketing tool.
Thank you very much, Jana. And I would encourage everyone to take the survey too. And hopefully no one will be a fail like I was when I got to the identify the mystery graphic. And hopefully people will do better than I did.
I think a lot of people don't know what it is. So we're trying to figure out what to do there.
Well, and that's where everyone can help in this process. Thanks very much, Jana, for joining us on the briefing today. And if there are no other questions for any of our presenters, that will wrap up the briefing for today. Our next media briefing is next week. We'll see you then. Bye, everyone.